Hey there! Welcome back to another episode of CUPE Cast. Are you hoping to learn more about unions or progressive movements? Then you're in the right spot. My name is Brianna Plummer. I use she, her pronouns.
And I'm Brittany Nisbet, and I use she and her pronouns, reminding you that we are the only podcast of our kind, combining union info, pop culture, and more, kicking ass for the working class, one podcast at a time. Whether you're a member of CUPE, in a union, wish you were in a union, or just found us while browsing, you're definitely in the right place. To hear more episodes, look for the CUPE Cast anywhere you stream or download podcasts. And for feedback or future episode ideas, don't forget that you can email CUPEcast at cupe.on.ca. That's CUPECAST at cupe.on.ca.
In today's episode, we will talk about the privatization of our healthcare system and how it impacts workers and patients alike. We'll be joined by Unifor member Tiffany, who will be talking about her experiences and challenges navigating the healthcare system.
Yes, we will cover this and so much more. So join us and listen to CUPEcast episode 40, The Human Cost of Privatizing Healthcare.
Welcome back to another episode of CUPE Cast, and this one is the big one because it is our 40th episode, the big 40.
Yay! We're like middle aged.
Oh gosh, you want to look at it that way, yeah. Um,
Podcast is middle aged,
yes,
not us.
or an older millennial, if you want to look at it that way.
Yes.
Yes,
Yes. Our podcast is officially in its elder millennium.
yes, phase. I'm so proud of us. 40 episodes is no joke. It is actually very monumental.
It so is. There's so much. This is like 3.5 years. 40 episodes is
Yeah.
3.5 years, and it has been so much hard work and such dedication. And unfortunately, this is also somewhat a sad episode because this will be my last one as CUPE Cast co-host. I've had an amazing 3 and a bit years and a phenomenal 40 episodes. And, when Tiffany, Elise, and I were first talking about beginning CUPE Cast, we spoke about how this podcast will really be a labor of
Mhm.
love, and it really has been. I have loved my time as a co host, and I will really miss it with all of my heart. But it is time for me to give space to others to learn and to grow and to develop as leaders, which is why I'm stepping away. But I want to take a moment to thank you to Brianna,
Mhm.
because you have just brought like so much wisdom and so much thoughtfulness to this podcast. And I don't even know if you know it or not. But you have really shown me the benefits of like sitting back, digesting information, and then forming an opinion on it. And that is a skill that I've learned from you.
Aw.
And I met you before you joined our podcast, and just watching you grow during our time together has been truly one of my favorite things, and I really cannot wait to see where you're going to take CUPE Cast and how it's going to evolve from here under your uh under your kind of leadership, and
Aw.
the next co-host either. You guys are going to do great things. I can't wait to see what you guys do.
I don't want to cry. That's so heartwarming.
No,
No,
don't
I'm not gonna cry. I'm
cry.
not gonna cry. We have a whole episode to record, so I'm not gonna try to cry. But I know I've known this for a while now. We're just telling our listeners. But yes, Brittany, I do want to thank you for also giving me this opportunity, for thinking and considering me as one of the co-hosts back at the end of 2022, going into 2023. I definitely learned a lot from you, Tiffany, who was also the co-host at the time. And I will take the baton and the wisdom and the skills that you, Elise, and Tiffany has put into this podcast, and I will ensure or try my very best with whoever the new co-host is to continue to allow this podcast to evolve and grow.
And I can't wait to see what you do.
Yeah,
Like I'm so it's going to be so fun to see where you take
mhm.
it.
And although Brittany is
Um,
leaving, just want to say this note: she's not leaving the labor movement. So
no,
if you are in the Niagara
no.
region, Brittany is still heavily involved, so please, like,
Very.
get in touch with her if you're in Niagara region. If you do
Yeah.
see her, say hello as well.
Yes,
Yes.
yes, yes, yes. Yeah. A lot of people are like, "Oh my god, she's leaving CUPE." She's not leaving CUPE. I am not leaving the labor movement at all. I'm not going anywhere. I'm just, like I said, it's time for me to make space for other people because, I think also as leaders, it's important for us to recognize when we are starting to take up too much space. So, I've really just wanted to start to make space for others.
Mhm.
So that's it. It's not for any other reason. I'm still involved in the Niagara Regional Labor Council. I'm still involved in the Niagara District CUPE Council, my own local. I am around. You
Mhm.
will you will not miss me. But thank you, Brianna, too. Like I said to myself before I got on this episode, I'm like, you are not gonna cry today, Brittany Nisbet. You are not gonna cry. But thank you. Okay, so before we're gonna get into our episode now. But before we get too much into it, I do want to mention that we do have a guest. Her name is Tiffany.
Mhm.
Uh, you guys are gonna love her. She is sharing a story with us regarding fertility and access to fertility treatments in Ontario. And so we do want to let folks know that we are going to just give a trigger warning because these conversations can be difficult for some, especially those who are going through treatments and wanting to start a family. It is not an easy journey.
Mhm.
It's one that I have gone through myself. So I know firsthand how difficult hearing about it can be. If the fertility process is something that you are going through or you're about to embark upon, we truly wish you all of the happiness, and we are sending so much love your way. But we also recognize if you are like, you know what, I'm gonna sign off, I'm not gonna listen to this episode, that is okay. You do what you need to do.
Yes. And we will also leave timestamps throughout in our show notes as well. So if you find that the interview is going to be too much for you as well, um, you will know where it is in the episode by referring to our show notes. And we
Mm-hmm.
do hope that you do find this episode to be informative as we be talking about the privatization of healthcare and how our healthcare services are crumbling under the current Ford government.
Yeah, crumbling is one way to put it. So before we jump into Tiffany's interview, we think it's important to highlight what has been going on with our healthcare system in Ontario and CUPE's stance on it. So before we start, Brianna, do you want to share some of the challenges that you are experiencing in our healthcare system?
So I guess I've been
If you want, only
no,
if you
no,
want.
I can. I think I've been fortunate enough, at least for now, that I haven't had to go through any like major health issues that I had to navigate through the healthcare system or need the healthcare system for. I think the biggest challenge for me is like those times I did have to go to like the hospital, for example, it would be the time wait. So growing up in Toronto, when I was younger, I used to live very close to a hospital. And then I think in my teenage years, they shut that one down and like two others and then created a mega hospital. So it's like three
Oh.
hospitals in one. And it so when you went to that now mega hospital, it's like the time wait and just waiting. And you just have to like be mentally prepared. Like when you're going to the hospital, you just have to wait. And so, just tying the pop culture piece here,
Mm-hmm.
when we think of like medical shows like, Grey's Anatomy, House, Chicago Med, The Good Doctors, this is just naming a few. Our perception of what our experience would be like when going into the hospital and receiving medical attention is very different from like the realities. These
Mm-hmm.
shows, one, they take place in America. I don't think there's any Canadian one that I've watched or heard of.
I don't think so.
Yeah. But these
Mhm.
hospitals like depict themselves as being resource rich, right? So they don't have like constraints of budgets,
Mhm.
understaffing, or like the government influence. When you walk into the ER, there's automatically a doctor, nurses, even sometimes
Mhm.
depending why you're in there, a specialist just waiting to treat you. And in reality, that is very different. So I
Mhm.
don't know, Brittany, if there's anything you would like to add or share.
Yeah. So like just how you were saying like the reality is very different. So interesting enough, last night I was at a labor council meeting and someone was talking about how this is specific to Niagara in Ontario. Niagara is number 4 in Ontario for hallway medicine.
Oh.
I know. That's crazy, right? When I heard that, I was like, "Whoo." And it was who was it that was talking about it? I can't remember because it was a long meeting because it was the first one since the summer.
Mm-hmm.
But yeah, so I just that to me was like mind boggling, and I have, I've had my fair share of needing to use our um like healthcare, and it's just, that people talk about the long wait times, and even a few days ago, like, Matthew and I were thinking, like, do we need to take Benjamin to the hospital because he was going through something, and we were talking to our doctor, but the doctor is even saying, like, I might have you go to the hospital, and I'm like, how long am I going to have to wait at this hospital with a 7-month-old
Mm-hmm.
who is unwell? And I'm like looking up the hospital wait times, and it's like midday on like Monday, and it's like 4 hours, 5 hours,
Mm-hmm.
6 hours. I'm like, Jesus. Like, it's, so for me, it's been more about that. And, I've experienced the, for in our episode, Tiffany talks a lot about her experience through the private healthcare and the fertility journey. And I've experienced all of that too. It's just, it's wild. And we know that fictional medical shows illustrate how illnesses and medical procedures are completed or resolved within
Yeah.
45 to 50 minutes. And like, we know reality, that is not the case. We know that medical procedures are often a journey and it takes a long
Yeah.
time. Um, like, I remember probably 8 years ago, I had a gallbladder attack and I wound up in the hospital for a week from it. It was really bad. And then I needed my gallbladder out. And they're like, yeah, you have to wait 8.5, 9 weeks now.
Oof.
I was like, I'm lucky it was only 8.5, 9 weeks, though. There are people that are waiting
Yeah.
years now. This was
Yeah.
8 years ago. There are people waiting years now. And so the misperception of what happens on TV and the reality of our system can truly be a disappointment.
I agree. And just for our listeners, the issues or challenges Brittany and I are flagging, we're just two individuals among the millions of people who live in Ontario. But we do want to just drive home that our experiences are a result of a healthcare crisis. So this means that in Ontario, our hospitals are continuously being underfunded, which has resulted in falling short of delivering services to the public and struggling to maintain staffing levels. In fact, it was reported in 2023 that Ontario has the lowest provincial funding for hospitals in the country.
Wow.
Mm-hmm.
And CUPE Ontario Council of Hospital Unions, also known as OCHU, they recently released a report titled No Respite, Ontario's Failure to Plan for Hospital Patients, which really sheds a light on the current situation in Ontario's hospitals. It explains the key factors driving this situation and how the current PC government is making it worse. Just to create a visual of what this means for our listeners, I'm just going to reference the infographic created by OCHU. So, failure to plan and properly fund hospitals means a projected shortfall of 13. I'm so bad with place value, Brianna.
13,000.
This is 13,800 hospital beds by 2023, a 25% increase in receiving care in hospital hallways and other unconventional spaces, and 7% increase in wait times for ER patients. And I'm sorry, I was kept in during recess in grade 7 because my place value was so bad.
Oh,
It was very sad.
yeah.
My kudos to my teacher. But yes, I just takes me a second when I see numbers and I'm like, what's that number again? Anyways, carry on.
And then also in a recent news release, President of OCHU, Michael Hurley, stated, quote, the data paints a dire picture. There is a massive gap between what Ontarians need and what this government plans to do. People are already paying the consequences for the Ontario PC policy of scarcity, and it's only going to get worse. We'll see longer wait times, more patients on stretchers in hallways, and fewer staff to provide care. End quote. In the same news release, it is noted that the main driver of shortages and increased wait times to deliver services is due to underfunding, which I stated earlier. CUPE Ontario has stated that in order to maintain current levels of service, it must increase its annual hospital funding by $2 billion. Whew, that's a lot.
That's a lot of money.
Yeah.
And OCHU president Michael Hurley also stated, quote, in 2018, Ford said he would end hallway healthcare. In 2024, he's joking about veterinary hospitals handling overflow. It begs the question, has this government given up on the hospital crisis? What is their plan to address the suffering of people due to the state of our under-resourced hospitals? End quote.
So if I was beside Michael when he said that, I would like raise my hand and be the annoying little bug and be like, privatization. And I know Michael would look at me very angrily and probably roll his eyes, and me too. Uh, and I know we briefly touched on privatization of our healthcare system in the episode Beat the Heat with Union Activism. Little plug, if you haven't listened to the episode, you should check it out after listening to this episode. But we'll go a bit deeper into like the privatization of our healthcare system.
That's right. And so in 2023, the Ford government introduced Bill 60, Your Health Act, which opened the door for private for profit clinics to permanently perform public funded surgeries and diagnostic procedures, including things like cataract surgeries, MRIs, and CT scans, gynecological surgeries, and knee and hip replacements.
Yeah, and the Ontario Federation of Labor, also known as the OFL, published a 3-page document in 2023, which highlights what is at stake through the expansion of privatization of our healthcare. So, some of the points they highlighted in this document included fewer public dollars going into our public healthcare system, failure to protect patients, worse patient outcomes, and an increase of the staff crisis. So we'll add a link to the document in our show notes if you want to read it and want to know more.
Yeah, and the government has pushed through this bill in its efforts to reduce wait times for public services and procedures. As the Ford government has said, Ontarians should still receive services, quote, paid by public health insurance. So, in other words, your health card, not your credit card,
Hmm.
quote, should cover what you need. But we know that that is not the case.
Yeah. In an article I recently read called Ontario's Healthcare System is in Crisis, More Privatization Isn't the Answer, the author David Morscrop makes an argument of why we should be investing and expanding our public healthcare system and not our private healthcare system. Morscrop notes that critics who are against the privatization of our healthcare system claims there can be discrimination towards patients who can afford to pay for additional services and those who cannot. In his article, he also states, quote, we know there is a lot of distance between what a government says in Queen's Park and what happens at a clinic 100 kilometers away. Not every patient will know the rules, best practices, or even their rights. The mere fact that private medical facilities operate to maximize profit and offer non publicly insured services puts people at a risk of being exploited. End quote. Morscrop also suggests we need to remove the profit motive from our healthcare system and build a model that focuses more on people. So, patients over profits.
Yeah, and thank you for sharing that article.
Mm-hmm.
It's a great read. And I think, I could be wrong,
Yeah.
but I think that David Moscrop, I think he has a podcast with CUPE 416
Okay.
called Left Looking In. I think. I feel like I've heard him on that podcast. I could be wrong. I could be confusing him with someone else. But anyways, if anyone's looking for another podcast, Left Looking In. Um, so yeah, so that article though that you mentioned is a great read, and I'll also say that it's embedded a TVO YouTube video was in it, which also explains and breaks down Bill 60 and the impacts. So if you're interested in reading the article or watching the video, we of course will have a link to it in our show notes.
And as well, CUPE members have also expressed concern about the Ford healthcare plan. So there was a recent poll created by the polling firm Nanos. They recently surveyed hospital workers represented by OCHU. This included registered practical nurses, personal support workers, housekeepers, and clerical staff. And the results are actually very quite grim. Nearly 4 out of 5 hospital workers say they are not confident in this government's plan to improve the sector, and more than 2 in 5 are considering quitting their jobs. Based on CUPE's news release that was published in June, highlighted the mental health toll of working in hospitals. So here are just some quick stats. 62% of workers polled said they were dealing with exhaustion and high stress levels. 41% reported dreading going to work, and 44% said they had trouble sleeping. Over half of them also reported that they were dissatisfied with compensation.
And Sharon Riche, the Secretary Treasurer of OCHU, stated workers are stressed out because their patients are suffering. They are stressed out because working overtime and skipping breaks is not enough. They are stressed out because they can see the Tories are not interested in addressing their working conditions or providing them fair compensation. Consequently, they simply end up leaving because they lose faith in the system. And I also want to share a quote from a worker who was included in the study. The worker said, "Our phones never stop ringing. Being asked if we can come in and cover a shift. You can be leaving work and you get a call before you even get to the parking lot saying, 'Can you stay?' You can do that once in a while, but it's literally every day."
That's a lot and really like heartbreaking to hear. With these results and the testimonials that we're reading in these studies, it's heartbreaking. At the end of the day, healthcare workers are people who we need to ensure that they are good physically and mentally in order to provide support to the public. If they're not okay, how could we ask them to deliver adequate services to the public? We'll leave a link to the news release about the recent poll and reports in our show notes.
We share a lot of stats and information with our listeners, and we wanted to set the stage for you. As you listen to Tiffany's interview, you will find common threads and themes that we mentioned throughout the show.
Yes, and we did call this episode "The Human Cost of Privatizing Healthcare," because the highest cost is us, the people, particularly how putting profits at the forefront of our healthcare system impacts the services we receive and accountability.
Yes. And with us hearing Tiffany's story, it will drive a lot of the issues CUPE and other unions have been raising about our healthcare. So before we jump into Tiffany's interview, I just want to reiterate that the interview might be difficult for some, especially those going through treatments and wanting to start a family. We will leave a timestamp in our show notes, like Brianna mentioned. And if at any point during the interview you find it too difficult, please just review to our show notes so you know where to skip to the closing.
Thanks, Brittany. And so let's go to the interview.
So today we have an interview and a chat with Tiffany. Tiffany is a member of Unifor and she currently resides in Oshawa. So Tiffany's here today to share a story with us around her fertility journey. So welcome, Tiffany. We are so happy to have you.
Yes,
Thanks so much for oh,
thank you for joining us today. Sorry about that. We're so glad to have you on the episode. Could you tell us a little bit about yourself and your journey?
so my name's Tiffany. I do, like I said, I reside in Oshawa. I've been going through fertility treatments with my husband for now just over, it'll be 2 years this October. Actually, it's over 2 years this October. We technically started in February of 2021. Um, and it's been a long journey. It's been a lot of physical hurdles, mental hurdles to go through. And everyone always kind of told me at the beginning of this that it's a lot, but like you don't know it's really a lot until you go through it and then you get the failures and the very little positives that come out of it in the end, and that just like the large for profit that kind of I've noticed in this over the past like over 2 years, and that so it's a lot, and I don't think a lot of people understand like the financial burden it can be on people. Like I've heard of people remortgaging houses, taking out loans, and that to get there. And there's some stuff that I've even experienced that was covered by the government, and I was told, by the way, you have to pay for this because it's private healthcare, and it's like, but the government, you're also semi-covered by the government for some things. So why isn't this portion being covered? And I was told, well, like I said, it's private healthcare. We can charge what we want.
hmm hmm So, yeah, thank you for sharing that little bit there. And so CUPE and other unions, you conveniently touched on this. So CUPE and other unions have been raising the alarm about the deterioration of public healthcare sector and the rise of privatization of the healthcare services. So this includes prioritizing the profit over patient care, staffing levels, and overall funding. So based on your journey to receiving fertility treatments, can you maybe highlight some of these deteriorations that you have seen or personally experienced?
So a lot of the deterioration that I've seen is it's a very my way, like not my way, but like for the offices, it's their way or the highway mentality. That if you don't do as we tell you and you do it this way and everything, you're not going to get this. And there's a lot of God complexes I've
Mm,
found with doctors that they hold over your head that you won't be able to have a family unless you jump when I say jump, you do what you say when you write a check for this.
Mm-hmm.
And it's a lot. It's a lot mentally on people more than just financially. So and like I said, there's some stuff I've experienced where I know that it's covered by the government, that I've researched it and being like, okay, well, this dye test, they do it. It's covered by the government. I had it done a couple months ago just by my OBGYN, but you guys want to now charge me 350 for it. So
Mm-hmm.
it's a lot. And then sometimes you get a lot of like I've gotten a lot of negative experiences from like nursing staff and ultrasound techs where they just start spewing all this information that isn't correct, or they don't fully know your chart history,
Mm-hmm.
and it gives people really bleak outlooks. And that's like a big thing with fertility that lays in the back is like the mental health that comes behind it. And that's already a big thing kind of right now, as is in the Ontario government, where people suffer all these mental health crises
Yeah.
and stuff. Like I never laid in bed being depressed and like crying and not wanting to get up until I went through some of this stuff. And some of it was caused by staff at these clinics
Mm-hmm.
because they couldn't really respect what people were going through and that.
Mm-hmm. Mm-hmm.
Thanks for sharing. Do you
Mm-hmm.
think you can expand a bit more on the barriers you experienced when trying to navigate through the healthcare system for fertility treatments, whether that's the private or public?
So I've done a lot of private, like 95% of everything I've done is all private.
Okay.
And the barriers I've received is like I said, it's a very their way or the highway approach. Like if I had at my the previous clinic I was at before the one I'm at now, that you had to pay these, like you if you didn't pay these guys like right then and there, they weren't going to talk to you, they weren't going to deal
Mm-hmm.
with you. And their billing and payment system was through another clinic. So I'd be trying to pay them and go to the other clinic, be like, okay, well here's my money. I've got it for you. And then they'd be like, oh, well, we haven't received the invoice. And I'd have to call the other
Oh
clinic, be
my
like,
God.
hey, there's no invoice here for me to pay this. And they would tell me, oh, well, it was sent. And then I'd go back and they're like, no, it wasn't. And I'd have to three-way call these people and be like, look, they're saying it's not here. You're saying you sent it. Please communicate between the two of you and
Wow.
find out what's going on here. And it would deteriorate like that. With these clinics, there's high volumes and high volume wait times. And that also kind of speak volumes about like this needs to be more publicly addressed and publicly funded because so many women are going through it. And
Mm-hmm.
they'd be like, you have to be here for this appointment at this time. And we would show up 15 minutes early and we'd be sitting in a waiting room for 2 hours
Yeah.
that I'm paying for. And at the same time, I'm taking time off work. My partner's taking time off work. So we're both like, it's like a lose-lose situation to try and get this goal at the end. And
Mm-hmm.
it's extremely difficult with that. Another like major barrier I've experienced also is like the staff. Like I said, I've not had a good experience with staff at a certain clinic where I was told I had paid out like a lot of money to do a procedure called an IUI, and I'd been hopped up on all this medication, and I had already gone through so many failures already that this was like
Mm-hmm.
the shining light that this is going to work. It's going to be okay. It's got a really good potential for you. And when I walked into this ultrasound tech's room, they told me, no, you actually have a very low chance of this working at all. And even if you do this multiple times, it might never work for you. After I had
Wow.
just come out of the doctor's clinic, being like, yeah, you guys have good chance on this, and that this is like this is going to be the answer for you, that you won't have to do IVF, and it was just like, it was a really negative experience. And when I tried to voice what had happened to me to the nursing staff, they're just like, well, don't do it then. And it's not like there wasn't any backing support being like, hey, that kind of sucks that you shouldn't have gone through that. They kind of just were like, they brushed it off. And when I spoke to the doctor about it, and that they were like, yeah, this clinician is actually really well known for speaking when she shouldn't be speaking about things, and that this isn't what actually happened. Like this has happened before, and I actually found out through going through like other fertility groups online and speaking to women in the community that they actually experienced this themselves with this tech, and it was kind of backed. And when it eventually came time that I was asked to leave because this tech continued to act inappropriately and explain things that they shouldn't be explaining, like um they're like, it's not, I understand, like it's a very, ultrasound rooms are very quiet, silent rooms, and it can be very cold at times, and that's really hard. Like totally talk to someone about their day, see how they're feeling and that, but don't make a journey that's already really hard even harder. And when this happened, I was completely like gaslit. Like this didn't happen. That wasn't said to me. And prior to this clinic, I never had cried really. I hadn't gone through like major bouts of depression and that, and it was like a whole big change. And when it came time that I was asked to leave, even the doctor was like, "Oh, this never happened. This wasn't a thing." And they didn't realize that I had been recording them. Like I would walk in after I was told like that this procedure wouldn't work. I started recording like the text, the nurses, and documenting everything. I'd have my husband there as just a third party witness being like, this is what's going on behind closed doors. And it was like, it wasn't listened to. And like I said, I was gaslit until I was like, hey, I have you being recorded. This is what has actually been said. I'm going to bring this to light to the people that head your unions, that head your governing colleges, and that because you're lying and trying to protect yourself because this is a big for-profit clinic, and that so it was extremely difficult to deal with that. And I'm kind of glad where I'm at now, because eventually, while going to this clinic that I'm at now and getting proper, like thorough testing done, I found out that I had wasted tens of thousands of dollars at a previous clinic when they didn't do this testing, and that they were kept pushing me to do other things. And if I actually hadn't gone to this clinic and used up like my government IVF cycle, it possibly would have failed because they weren't doing the proper testing, and they weren't putting my husband and I on a proper like vitamin regime and medical regime and like just like daily life habits and that. Like, 'cause I had been doing a lot of changes myself and that, but there was stuff my husband was supposed to do and they never addressed it. And that's like another big thing in fertility, is they always think it's the woman's problem, which yes, there is sides that where it is women, but you have to look at side A and side B of like these aspects. And some of it is like, it's not what anything my husband did was wrong. It was just it was he needed to go to the gym more and be more active. He needed to be on proper supplements and that too, which wasn't addressed. And like it was never, we never got like a DM. The big thing we didn't have done was a DNA fragmentation test, which I tell every woman now that when they go for testing, like ask for this test, because it breaks down sperm analytics and can see what is actually wrong, and that
Mm-hmm.
compared to them just only
Mhm.
breaking down what's wrong with a woman, because usually when you get a sperm analysis, they just tell you, oh, you have this count, the motility is this
Mm-hmm.
and that, but they don't break down like acrosomes, or if it's missing parts of the analysis of the sperm and that, because that's
Mm-hmm.
what can cause like chromosomal defects, or
Mm-hmm.
just for like the whole process itself not to work. And that,
Mm-hmm.
and it, ways you can fix that is just literally like changing your lifestyle a bit. Even if you have a lifestyle, just make it a little more healthier, and
Yeah.
putting like vitamins and stuff, like I said, into place. And that none of this was discussed at this clinic,
Mm-hmm.
like I said, and it was just completely ignored and that.
Mm-hmm.
So, and even then when I was coming in for IUIs and I was showing up for the time slots, and that the nurses weren't even there, they were in the back chit chatting, having lunch when I was supposed to be there. And they were like, oh no, you were supposed to be at this time. And I'd have to pull up on my phone, like, actually, it says this. This
Wow.
is the time I'm supposed to be here. This is when it was supposed to happen. And that, and when, like, that's the neat thing also with paperwork, it's there's a paper trail. So you can say one thing, but I have these documents that say something
Mm-hmm.
else. So it's a big thing to always like follow your paper trail, and also follow kind of like what your gut says too, because
Mm-hmm.
there's going to be there's going to be a lot of human error in this
Mm-hmm.
too. And
Mm.
it's that like that doesn't help also when it comes to like your mental health in this, because
Mm-hmm.
you have to
Mhm.
expect this error and that, but like you would kind of expect like a little less, because you're
Yeah.
putting
Yeah.
tens of thousands of dollars out, you're
Yeah. You're
putting
paying for it.
your you're putting your body out there too.
Yeah. Oh
And
yeah.
that like I've told people, I'm like, it's like going through this mental physical roller coaster, because you're on all these hormones, and there's some days you feel great and you want to love and hug your partner, and there's days you don't want to get out of bed, you don't want to eat, you don't want to walk your dogs. I myself, I'm going through secondary infertility. I didn't want to even deal with my kids at times, because you're going through this. And I had mentioned even to my doctor, I'm like, I'm suffering mentally from this, and a lot of I'm suffering from mentally was occurred by this tech, on top of being put on all these hormones, and I wasn't supported mentally. I wasn't.
Mm-hmm.
They didn't reach out and be like, there's these services you can speak to, or why don't we see if we can put you on some medications that will help you with that. And none of it
Mm-hmm.
was addressed there. And when moving to my new clinic, they're like, here's a fertility therapist. We need you to speak to them.
Oh,
And if you
amazing.
feel this way, here are social groups to speak to, and that
Mm-hmm.
and everything. And it's great that they have these. There's also like when you speak to a fertility therapist, it's a little more expensive than a regular therapist too.
Oh yeah.
Like $300-400 for $100 for a 1 hour session. And that compared
Mm-hmm.
to I have a therapist myself I speak to, who's been through this whole journey himself with his wife, that actually ended up having to adopt too. And he's kind of like talked us through a lot of like these issues and that.
Mm-hmm.
So it's it's great. So yeah, those are just like some of the barriers. There's probably more that aren't even coming to mind here, because like I said, I've been through this for over 2 years, and it's like trying to claw back all these like,
Mm-hmm.
memories of not being heard or listened to or diagnosed properly, and that. So
Mm-hmm.
it's like it's a lot.
Mm-hmm. And so you touched on this quite a bit when we were just like when you were just chatting about some of the negative impacts that you've dealt with. So like, for me, I could pick out like, you were dealing with a lot of mental health stuff and there's a lot of stress on this whole process too, and that's definitely negative too, and not being listened to, and your time being wasted by the clinics when you show up for the appointment and they're not ready or they're just making you wait. And so you've definitely touched on a lot of negative impacts of going through the private sector for this healthcare. But is there anything else that you want to share with us that was like a negative impact of going through the private sector at all? Like I said, you touched on it quite a bit. So if there isn't anything that you feel like you missed, that's totally okay.
So it's a lot of the big negative thing is a lot of the like I said, not being listened to, not being heard, even though you're paying. And the thing is they always you walk into those places and they want to see your credit card, they want to see your check book before you do anything, before you even speak to them. They're like, here, we need $400 up front for a year's worth of cycle monitoring. We need to have your money up front for this medication before you do it, and it's very it's very financially stressful, and that to be able to do it. And a lot of this also I went through before I was in a union, and that so now I'm kind of lucky that I have some coverage. I have really good coverage now, actually, to be able to do this. But prior to not having that backing, it was very financially frustrating, and that they just kind of looked at you as a dollar sign instead of someone that they wanted to help. And they would tell you they want to help you, but it didn't always feel that way. And that and it's you would think because it's private and you're paying that they'd want to help you, they'd want to do more, but they don't. They just they want to get that extra dollar to be able to get that nicer looking clinic, or for the doctor to have that brand new Lexus. And that it's just it's it's so frustrating to not be listened to and heard. And when they sit there and they advertise that we as a clinic are the most successful clinic, we are the one that are the most for women and want to be very inclusive in that way, and it just turns out to be a Ponzi scheme. And it's just another way for you to be encouraged to spend more money there. And that's kind of like the big stressful thing for for-profit healthcare, when the reality is something like this shouldn't be for profit. I think every woman should have access to be able to do these things, to not have to worry about, hey, do I have to take out a loan for this? Do I need to remortgage my house? Do I have to go into my personal line of credit for this? And it's just, this should be a basic human right, that if you want to have a kid, that it shouldn't come with this huge price tag.
Yeah, so Tiffany, you touched on it, that this fertility treatment shouldn't be under for profit. And you also touch a lot on, these private clinics are thinking dollar signs over the patients. So if you could touch a bit more on why fertility treatments should be totally publicly funded. I know earlier we touched on some parts of it is publicly funded. A lot of it is you have to pay out of pocket. Why should this just totally be covered by the government?
Because it's a basic human right. I think this is a right that if someone wants to be able to have a child, you shouldn't put up barriers, especially financial barriers. And that because not everyone has the ability to do that. And that I know people who want children but can't do it because they're struggling with fertility, and they can't afford all these medications, and they don't have health benefits to back them. And that there should be, if you want to have a baby, we should let you have that IUI. We shouldn't be charging you $500 for a sperm wash. If IUI isn't a thing for you, we shouldn't be charging you $20,000 for IVF. And you have to think, in Ontario, you only get one IVF cycle that's paid for. And and that's just recently that they've covered one IVF cycle. And the thing with an IVF cycle is it's not always successful the first time around. And so I know people who've done IVF like 5 or 6 times, and I'm just like, how do you afford it? And they're like, well, you got to see the loans we've taken out, and that's those people are going to be paying those loans until they're in their 60s. And then you got to think, once you have that baby, you got this bundle of joy in your arm, but then you also have to think you're paying for crib, diapers, everything like that too. And that's a financial expense. Yes, I understand the government shouldn't be covering that, but why not make it where everyone can achieve this dream? And even government funded IVF cycles, they don't cover the medication. And medication alone can be anywhere between like 2,000 to I've seen people spend $10,000 on
Wow.
medications. Yeah. And it's it's like it's very mind-boggling and struggling because like they get out some places only use certain products because it's I don't I know that you can't get like sponsorship or have it where like in the States where drug companies can come in and give benefits to doctors like you can if you use our drug it's like that, but it's still kind of very much that way in Canada in Ontario, and that because you can I've had it where you can only buy the drugs from that clinic. You're not allowed to go outside the clinic and get it somewhere else that's cheaper. And that they're like, no, it's us or the highway. And I researched drug prices in other places, and it's mind like I said, it's mind boggling. I don't understand why it's just not if you're gonna have these drugs, why not have a set fee? They have dispense fees that are just through the roof through some clinics, and then some clinics don't have dispensing fees, and it's like I said, it's it just I can't wrap my head around it, and that's like a huge barrier for women, and like I said, it needs to be addressed that we can't all afford this, that we can't all do these these things that we need more than one IVF cycle, and that yeah we have unlimited IUIs, but why are we being charged $500 for a sperm wash, and that only takes them an hour to do, where they have equipment that is partially covered by that clinic, but also the government paid for that equipment too for them to have it. So it's like I said, it's just mind boggling, and that
Yeah, and like not to mention the wait lists to access like the IVF. Like I know so when before we recorded I chatted a little bit about like how like I was on a fertility journey too, and they told me that the wait list for the IVF cycle was almost 2 years.
yeah I've been roughly a year in a bit. I'll be coming up to a year this April when I make it to the top of the list. We're actually next month we're paying $20,000 to do IVF to jump that wait
Wow.
list.
Yeah.
And before I was on this wait list, I was on my previous clinic's wait list where I was once again waiting over a year for it. And when they asked me to leave, they're like, "Oh, you can go to this clinic. It only has a 6 month wait list." And when I called them, they're like, "Actually, that's not the truth. We have over a year wait list too." And I'm like, when I called the doctor back, I was like, "You lied to me." She's like, "Well, I can't tell you these things." I'm like, "But you told me this. I have a recording of you saying that this clinic was 6 month wait list, and that what your clinician or what your tech had done had removed me off your list, that I was almost at the top here, that I had dumped thousands of dollars into this and just been treated so poorly by your staff, and it wasn't addressed to your staff that hey you need to treat people better. Instead it was just like no, it's it's the patient's fault, it's the patient that's having a hard time, and none of the staffing issues were addressed whatsoever.
Yeah, that's awful. I'm so sorry.
Me too. To
That's so
hear this.
awful. So
And I hear that a lot from people that I'm sorry, and I say it to a lot of other people because I'm not the
yeah.
only one. I hear in these groups speaking like I was told by nurses, like I've been told by women that nurses have just disregarded them or like lost files and stuff like that. It's just like I said, it's mind boggling
Oh,
how you pay all this money for these people to have this, and it's just disregarded completely.
yeah. So you had spoken a bit about how, and we had said before, like you are now with Unifor, which yay, unions,
Yay,
hooray.
unions.
So how do you think that locals can better advocate for members who need to access for fertility treatments? Because now this is something that you're experiencing in your new work with your local. So how do you think that yeah, how do you think locals can better advocate for the members that they have that need to access fertility?
So we in my union, we actually have a female advocate, which is really cool. That if we don't feel comfortable speaking to a man about what we're going through, 'cause I personally, if I was walking up to my union representative who's a guy, I would be able to like, hey, I'm going through IVF and that I'm struggling a little bit with it. I'm going to be missing some time off work. How can I how can you guys support me? It would be really weird, but I'm lucky that I have this woman that I could talk to and that is able to support me with what I'm going through, and she completely sympathizes with that. I think the other thing is having unions where they not just cover costs of like the drugs, but putting like a fund aside to help cover the cost of IVF itself, because IVF, like the procedure alone, is anywhere between, I've seen clinics for um 12 like I'm always bad with putting numbers out, but over like uh $15,000
Hmm.
or $12,000, and that like I'm probably getting these numbers wrong. Like I said, I'm not always the greatest with them. I'm a little dyslexic when it comes to them. So yeah, it's just it's ridiculous like that. And I think having a union backing you and being like women need these things, and not just women but also men, because this is another silent thing in fertility that they don't always look at, is like the men's mental health aspect
Hmm.
and the stress that they go through because they're supporting a partner, but they're just along with you with all these fails. And that I think having it where like, because I paid for these like sperm analysis and that, and I paid like $350 for them, like having unions cover these things and making sure that those parts are looked after, and that like the men's mental health is like they're checking in with them being like, okay, well, you need some help with that. And the great thing with unions is even if your husband isn't in the union, they can support him too, because they can be like, okay, well, you do have this mental health coverage that
Hmm.
extends to your family, and that, and just increasing the budget for some of these things too, because like some unions only have a $500 a year budget that each member can have, and that, and some clinics, like that's like 4 sessions if you're lucky. And then
Hmm.
people need more than just 4 sessions to talk to someone. And that sometimes you have to talk to someone every week. Or I've had it with my therapist where I've had to call them like a couple times in a week being like, I'm not doing good with this. And this is what I've gone through. And I'm
Hmm.
really lucky that the guy that I see sometimes just waves the feet. He's like, you're struggling. I can see
Hmm.
you're struggling. I've known you for years, and this is like a new thing you're really having a hard time with, and we need to kind of address it and that.
Hmm.
So
Hmm.
I think having bigger budgets and that, and just bigger support put in place for people that are in the union, but the spouses that aren't in the union but are still supported because
Hmm.
they're lucky enough to have a spouse that's a member of these great teams and that.
Hmm.
All right, thanks for sharing. We just have one more question for you.
Yeah,
So, what
totally.
advice would you give to a union member who might need fertility treatments or who is currently on the journey?
um be vocal, be vocal, because I was silent for a bit and I stopped being silent about it. And when you don't feel that you're being treated fairly by these clinics, go above them, because they have governing colleges. And that's kind of what I'm going through right now, because the director of this clinic that was a doctor didn't listen to me. And then I went above her and I went to the college of um, medical imaging and that, and presented a lot of facts that I had and paperwork, because this woman, when you go through these things, this woman responded to what I sent, and she lied about a lot of stuff and gaslit stuff, and then I had to literally present hard facts and recordings of what had gone on. And the big thing too is like not just like going above and like speaking to these people, but also find people within your community or within your union that are going through it as well or have gone through it, and that needs to be vocalized more, that you're not alone in this thing, that 1 in 4 women struggle with infertility, and that
Mm-hmm.
and that you will be in that room full of women and count how many are there, and you got to think, okay, there's 16 of us, so 4 of us have gone through this, and each one of us has a different journey that we've gone through, and it's going to be different, but we're going to have similarities, that we're going to have had the same mental struggles, or we may have gone to the same clinics and experienced the same discrepancies, and just having that extra person to speak to and to lean on is really great to have, because I've been really lucky that I know not other women in my union, but other women who went to this clinic that I went to and receive this kind of care.
Okay. Well, we just want to thank you so much for sharing all of this with
Yes.
us, and with our listeners. And I I know it's not easy to talk about. Um, so I really appreciate you being open and wanting to talk about it and coming to us and saying this is my story and I want to tell it. And I know that folks who are on this journey who aren't speaking on it definitely will also appreciate hearing someone
Yes.
talk about it.
That was the
Um,
main reason I wanted to do this. I want to hear more women
mhm,
speak up about this, because it's a silent killer,
mhm,
and you
Yeah.
silently suffer, and it's no more of that. No more.
mhm,
There should be no stigmas, no barriers when it comes to
mhm,
this. That women, that if this is what you want to do, you want to have a child and you're struggling with it, you should be able to access this care. That you shouldn't
mhm,
have to remortgage your house. That you shouldn't have to sit there and worry that this one cycle of IVF that the government's going to cover is going to be the thing that does it all, and that you should be able
mhm,
to access it more than once. And
mhm,
Mm-hmm.
mhm. Yeah, and I really hope that after our conversation with you, that folks have a better understanding of fertility and the access to fertility and the
Mm-hmm.
treatments. This journey is really not an easy one. And
mhm.
we like Brianna, I'm speaking for Brianna and I, but Brianna co-signs on what I say too.
Yes, I
So
do.
we really hope that this ends in happiness for you and your family. And again, thank you so much for taking the time to come and chat with us and our listeners and shedding some light on this, on
Yes.
fertility and the access
Yeah,
to it.
yeah, no
Um,
problem, and thank you for having me.
yeah.
Wow, that was such an impactful interview we had with Tiffany. We both really appreciate her taking the
Yeah,
time
yeah.
to come out to tell her story. She actually reached out to us a few months ago,
Mm-hmm.
and I'm glad that we were able to make this happen. And I really hope
Mm-hmm.
that you, the listener, enjoy her story and learn from her story and her journey. So, as a quick
Mm-hmm.
takeaway, I want to share a Mythbuster fact sheet created by the
Ooh.
Ontario Health Coalition. Yes, this just came out. Well, when we're recording, this just came out. The Ontario Health Coalition has gathered the 10 biggest myths about our healthcare privatization and what the Ford government has been doing to push their rhetoric about being for the working person. This fact sheet is to help bust these myths and to clear the air about our healthcare privatization, as well the risk that the Ford government is doing by creating these policies and how these policies are impacting Ontarians everywhere.
Yeah, thank you for flagging that, Brianna. And as the conversations about privatization of our healthcare continue, we really want to encourage our listeners to take time to understand what that means and how it will impact you, your family, and community, not only today, but in the future. And of course, we will leave the link to the fact sheet in our show notes.
Yeah, so I guess this is a great spot to transition to our closing segment. So just
Hmm.
before we sign off, we have a few reminders. So first things first, since it's September now, it means conferences are beginning. The CUPE Ontario Health and Safety Injured Workers Conference begins October 21st, and it will be held in Markham at the Sheraton Parkway North. Then a few weeks later, there'll be Fall School, which will be held on October 29th at the downtown Sheraton.
Yeah, and there will also be the CUPE Ontario Young Workers Conference.
Mhm,
That's November 14 to 16.
mhm.
Then the Women's Conference will be November 25th to the 28th, again at the Sheridan Centre downtown in Toronto. Are you going to be at any of those, Brianna?
I will be at both.
Oh, I
It,
thought
I
so.
will be at both. At some capacity, I will be at both.
Yeah.
Yes.
So if you guys see Brianna, make sure to go up to her and say hi. And if you are interested in any of these conferences or fall school, check out CUPE Ontario's website for more info and how to register.
We also want to let our listeners know that September 30th marks National Day of Truth and Reconciliation. It is a day to pay tribute to the children who never returned home and the survivors of residential schools, as well as their families and communities. In recognition of this day, we want to highlight an old CUPE Cast episode from 2022 called From Reconciliation to ReconciliACTION. There's a segment in the episode that talks about missing and murdered women and the residential school system. If you haven't had a chance to listen to that episode, definitely encourage you to listen to that episode. We'll leave a link to it in our show notes.
Yeah, and our last reminder is October 1st is Seniors Day of Climate Action.
Mhm.
This day is Canada's National Seniors Day and International Day of Older Persons. On this day, the Seniors for Climate is organizing and bringing awareness about the growing concern about climate breakdown and our desire to rebuild a healthy environment for future generations. If you have a retiree committee or senior members who may be interested, make sure to let them know, and you can share the link that will be to the website, and that link will be in our show notes.
Yeah, so that is all from us today. Thank you. You just listened to CUPEcast episode 40, The Human Cost of Privatized Healthcare. This podcast was written and researched by us, Brittany and Brianna. We want to take a moment to thank the CUPE Ontario staff involved with this episode. Without them, this podcast would not exist. If you have future podcast ideas, please email us at cupecast@cupe.on.ca. That is CUPECAST@cupe.on.ca. We also want to thank our friend Mohammed Akbar for being the great edit master. This podcast would not sound as great as it does without his talents.
Yeah, and before we close out, we want to thank you, all of our incredible listeners, for tuning in to this episode of CUPE Cast. Please continue to look for us anywhere you stream or download podcasts, which include Spotify, Apple, or on the CUPE Ontario website. Please follow or subscribe to the CUPE Cast, and if you listen to this podcast on Apple or Spotify, write a review, leave us a message, and let us know what you thought, or share the link with your friends or fellow members in your local. Thank you for listening. We'll see you next time. Sending solidarity.